Hello and welcome once again. Today we're looking at cancer. So this is cancer from the AQA specification. Now, these questions are the starter questions looking or reviewing the work we did in the previous lessons looking at non-communicable diseases. Name three risk factors for cardiovascular disease. So, poor diet, smoking, and lack of exercise. So, you need to eat healthy diet, avoid smoking, and engage in regular exercise. Those will most definitely reduce the risk of developing cardiovascular disease. Name one risk factor for type 2 diabetes, and that would be obesity. Name one risk factor for liver disease and brain disease. So you have high alcohol consumption. So that would be like binge drinking. So binge drinking or alcoholism. So if a person is an alcoholic, then they are at risk of developing disease of the liver. So high alcohol consumption is a risk factor. Name one risk factor for cancer. So exposure to radiation or exposure to high ionizing radiation or exposure to carcinogens. Spending too much time out in the sun, direct sunlight is a factor. Name two risk factor for diseases in newborn babies. So that's where if the mom is a smoker or heavy drinker of alcohol, so smoking while pregnant, so smoking and drinking maybe large quantities of alcohol. So drinking alcohol are two risk factors. While pregnant. Okay. Now in this unit, or rather this lesson, we're looking at cancer, and according to AQA, students need to be able to describe cancer as a result of changes in cells that leads to uncontrolled growth. You need to be able to describe benign tumors, that they are growths of abnormal cells which are contained in an area, usually within a membrane, so it doesn't spread, it doesn't invade other body parts. Malignant is the other type of cancer or tumor, which is, they often call it the malicious cancer because it's the one that will spread and invade neighboring tissues and spread to different parts of the body in the blood where they form secondary tumors. Types of cancer. We're going to learn about 6 different types of cancer. And in doing this, we'll be looking at different cases and then we use our knowledge to answer a few questions after that. So it's how we can reduce the risk factors. So you're going to be able to name these cancers, risk factors of each of these, and areas of the body where it affects. So for this first one, you have the lung cancer, types of lung cancer. So there are two main types of lung cancer: small cell lung cancer and non-small cell lung cancer. They are treated differently. Small cell lung cancer is called this because when the cancer cells are looked at under a microscope, they're very small. Small cell lung cancer is usually caused by smoking, and it's rare for someone who has never smoked to develop this type of lung cancer. Small lung cancer is often fast growing and can spread quickly. Non-small lung cancer. There are three main types of non-small lung cancer. The cancer cells appear bigger under a microscope. Risk of lung cancer. So I'm over here. By far, the biggest cause of lung cancer is smoking. It causes more than 8 out of 10 cases, which is 86%, including a small proportion caused by exposure to secondhand smoking in non-smokers or passive smoking. So, for example, if parents smoke or if a friend smoke who you're always hanging out with, you will be classified as a passive smoker. Preventing lung cancer. Do not smoke is the best way, or stay away from others who are smoking. Maintain a healthy diet and exercise regularly. Lung cancer is the second most common type of cancer in the United Kingdom. This excludes non-melanoma skin cancer. Around 43,500 people are diagnosed in the UK each year. It's a lot of people. Skin cancer. Risk of skin cancer. Exposure to the sun's rays. So if you spend a lot of time out in direct sunlight without the protection, etc. Using sunbeds. If you have fair skin or pale skin. Red hair. Age. So basically people who have red hair, they're saying you're at a higher risk. Your age, so the older you are or younger, you are at a greater risk. Family history of skin cancer, other skin conditions, sunburn, moles and freckles on the skin. What is skin cancer? There are two types of skin cancer. You have melanoma and non-melanoma. Non-melanoma, I'll say it again. Non-melanoma skin cancer refers to a group of cancers that slowly develop in the upper layers of the skin, while melanoma is a type of skin cancer that can spread to other organs in the body. So the melanoma is the more dangerous of the two. Preventing skin cancer. Wear high factor sunscreen or sun cream. Stay out of the sun in the heat of the day, around 12 noon to about 3 o'clock, depending on where you are in the world. Those are the times when the sun is hottest. Do not use sunbeds, and wear a hat with wide brim and also sunglasses. Skin cancer is one of the most common cancers in the world. So once again, look at these points over here. Risk of skin cancer. See if you fit in any of these categories, and look after yourself when summertime, spring and summertime comes around. Next is cervical cancer. So this one affects females. What is cervical cancer? Cervical cancer is a type of cancer that develops in a woman's cervix, that is, the entrance of the womb from the vagina. Almost all cases of cervical cancer are caused by the human papilloma virus, HPV, which is what teenagers are vaccinated against when you're in between year 8 and year 9 in schools. The nurses come, they have you all lined up, and you're vaccinated. HPV is a very common virus that can be passed on through any type of sexual contact with a man or a woman. There are more than 100 different types of HPV, many of which are harmless. However, some types of HPV can cause abnormal changes to the cells of the cervix, which can eventually lead to cervical cancer. Risk of cervical cancer. HPV virus is a risk. Smoking, sexually transmitted infections like chlamydia, being overweight, long-term use of oral contraceptives, family history, and having multiple pregnancies. So that is a risk, though every female, or as many females as possible, want to have children. So it's keeping up with medical care. When you're invited for example, smear test, it's important to go and have it done, because then they can identify if you have any of these cells and how they can treat you to prevent this spreading. Preventing cervical cancer using condoms. HPV vaccinations now given in schools. The NHS carries out routine cervical smear tests for women. I think it's every 3 years that you females, you're written to by your GP. You then make the appointment, you go and have this smear test done. If all is well with the sample you've given, you'll be written to and told that everything's okay, no abnormalities were found. However, if there were abnormalities identified, you'd be invited back in, and then you can discuss the course of action from there. And of course, the final one is do not smoke. So you can see that smoking have a significant amount of negative impact on the body, and it's best to not start in the first place. Next is what is breast cancer? So breast cancer is another one that is can be quite fatal. So there are several different types of breast cancer which can develop in different parts of the breast. This can occur in both males and females. Breast cancer is often divided into non-invasive and invasive types. Non-invasive breast cancer. This cancer is found in the ducts of the breast and hasn't developed the ability to spread outside the breast. Invasive breast cancer, on the other hand, has the ability to spread outside the breast, although this doesn't necessarily mean it has spread. Breast cancer. Preventing risks of breast cancer. Breast cancer screening for those over the age of 45 uses a mammogram. See picture? So that's this picture right here. Regular exercise and healthy diet. Breastfeeding can reduce your risk. So basically, once a woman has given birth, she's encouraged to breastfeed her baby. Some women simply can't, while others unfortunately chooses not to. But either way, we have to stay aware of the female needs to stay aware of her body. Any changes, she needs to seek medical support or advice as soon as possible. Risk of breast cancer. So age. Women are at a greater risk than men. Inherited genes. So if a member of the family had it before, there's a chance you might be carrying the gene. Race and ethnicity. White women have a higher risk of breast cancer. Breast cancer is the most common type of cancer in the UK, which is quite frightening. Testicular cancer. So this one only affects men or males. Risk of testicular cancer. Men born with abnormal testicles. Middle-aged men. Your race, most common in white men. Family history. Tall men are more at risk of testicular cancer. Smoking, infertility, sexually transmitted infections, example HIV. What is testicular cancer? Cancer of the testicles, are also known as testicular cancer, is one of the less common cancers. It usually affects younger men between the ages of 15 and 49. Preventing testicular cancer. Safe sex, so use condoms. Do not smoke. Get regular GP checks to, so if you sense that they are painful, or if there are any lumps, there is one not to ignore, but you need to seek out medical checks or medical advice. Testicular cancer is difficult to prevent. Brain tumors. This can happen to anyone. What are brain tumors? A brain tumor is a growth of cells in the brain that multiplies in an abnormal, uncontrolled way. It can either be cancerous, malignant, or non-cancerous, benign. Brain tumors are graded from 1 to 4 according to their behavior, such as how fast they grow and how likely they are to grow back after treatment. So, if a person has brain tumor, they have raging headaches, ones that you take a paracetamol or any other very strong pain medication and the pain will not go away. It's basically one to not ignore, or rather, you cannot ignore it. Risk factors of brain tumors: age, medical radiation, previous cancers, genetic history, being overweight, smoking, alcohol. So you can see where lifestyle choices can have a significant impact on a person's, on people or persons developing certain conditions. But it doesn't have to be, of course. Preventing brain tumors. So don't drink or smoke. Healthy diet and exercise. If you show any symptoms, go to a GP to be checked as soon as possible. Example: persistent headaches, drowsiness, vomiting, problems with vision, and seizures, etc. Right. So now let's have a look at a few questions here. So they are level 1 and level 2 questions, just to check to see if you have gained the basic knowledge of cancers. Cigarette smoking is the main cause of cancer in the UK. Mutations in cells cause cancer. Where in a cell do mutations happen? And that's the nucleus. B. Why do some cancers develop into large tumors? Why do cancers develop into large tumors? And it's because the cells never stop dividing. So they divide very, very quickly, and the mass of cells become bigger and bigger over time. Communicable and non-communicable diseases are major causes of ill health. Which disease is a non-communicable disease? Is it AIDS, cancer, gonorrhea, malaria? And your only possible choice here, non-communicable, is cancer. It means that if you have cancer and I'm sitting next to you, I can't catch it. So you can't pass it on to me because it is not caused by a microbe, for example, bacteria, fungus, virus, protists, etc. And last one on this page, obesity is a risk factor for many non-communicable diseases. Give one non-communicable disease that obesity is a risk factor for. Do not refer to diseases given in part A in your answer. So obesity is a risk factor for um, heart disease, um, you could say diabetes as well, etc. National policies are used to help people who are obese to lose weight. One national policy is to reduce the amount of sugar added to food and drinks. So just one other national policy that could be that could help people to lose weight. So they one of the things they've done is they've put taxes on high energy drinks like Pepsi, um, Coca-Cola, all of those. And they do exercise campaign as well. Exercise campaigns. They would have put calorie information on food. If you go to restaurants, you can actually see it on the on your menu. They have given more information on food labels. They've restricted media advertising of high fat foods, like, for example, McDonald's and Burger King, where you would see their ads up. You go to the train station, it's there, the tube station, it's there. Everywhere you look, there is these high fat foods. So, it drags you to want to eat them. And of course, they're not good for you. Now, scientists estimate that about 1/3 of cancers in the UK may be linked to obesity. Name 2 diseases linked to obesity. Do not give cancer as one of your answers. So you can have arthritis. Okay, I think I've lost. Where is it? It's back. So arthritis. So that's where you have pain in your joints. Diabetes, for example, type 2. And type 2 diabetes is when your body is, or your pancreas is making and releasing insulin. However, the body is not, your cells are not responding to it. High blood pressure, and heart disease, disease of the blood vessels, etc. Okay, so these are some of the things that could happen when a person is obese. So regular exercise is important for so many reasons in our bodies. Now, I hope this lesson was helpful. It informs you about diseases that can develop as a result of certain lifestyle conditions, but that it doesn't always have to be the case. But in order to avoid these happening, all the person needs to do is to engage in regular exercise, no drinking, no smoking, go having regular medical checkups if you notice anything that is out of place, and so on. Thanks again for watching, and I hope that you like and subscribe and also share my videos with your friends. Thank you. Bye-bye.